My name is Alana. I'm from Perth, Australia. I was 37 years old when I was diagnosed with grade 3 triple positive breast cancer. I had a 1-year-old son and I was pregnant with my daughter. So I have had lumpectomy, I've had a left-hand side mastectomy, a right-hand side mastectomy with immediate double-dip reconstruction. When I was diagnosed with cancer, I was pregnant and it was absolutely terrifying. I was so worried about my little one, but I knew I had to do everything to fight it for both of us. So my immediate treatment was surgery followed by chemotherapy. There was certain chemotherapies we could do and the rest we had to wait until after my little one was born. My biggest fear was for my little one that I was pregnant with. I was absolutely terrified for her, and so I just knew I had to do everything all of the medical professionals told me to fight it for her and I. What I found most helpful in the initial part of my journey was hearing other women's stories. People that I'd met online, people even shared their pictures, their stories of what they'd been through during the lead up to surgery and then recovery, and that really helped knowing what I was going into. So the first 48 hours, I will be completely honest, was horrific. I was in ICU and I couldn't leave ICU because my blood pressure was not high enough. It was hard to eat when you're in ICU because you're bent in half pretty much. On the third day I was allowed to go back to the ward, and that made such a difference. I was able to stand up, we stopped the pain medication, so the nausea stopped, the blood pressure had gone up, so I was feeling a lot better. I was able to shower, which was the biggest thing, and could walk around the ward, could sit up a little bit better in bed. I had my mastectomy on the left-hand side, and my right-hand side had actually changed after pregnancy and after treatment, so that's when it was decided by my breast surgeon to remove my right-hand side and do the immediate reconstruction. And it made me appreciate the results of my reconstruction so much more because I had experience being flat-chested. The recovery from my mastectomy was a walk in the park. The recovery from the DIEP was a lot harder. The biggest worry I had for recovery was not being able to hold my babies. So I actually broke down in the plastic surgeon's office because I got told that it would be at least 6 weeks before I could pick my children up, and having a 1-year-old and a 2-year-old at home and not being able to pick them up was absolutely heartbreaking. So I knew I had to do everything I could and listen to the doctors so I could recover a lot faster. So the physio in the hospital do come to see you every single day that you're there for the 5 or 6 days, and so the first couple of exercises it's just getting you to stand up. Then it's teaching you how to shower properly, how to get changed afterwards because your movement is so limited in your arms, and you have to be so careful. You have to bathe in your bra, which is very odd. You have to learn how to get changed after your shower without putting pressure on your breasts. You have to lean back so you aren't damaging the blood vessels that have been operated on. So the physio teachers taught us all of that. They taught me how to go upstairs because we've got a double-storey house. They taught me breathing exercises because everything had been with the anaesthetic that had to do. You have to learn how to do breathing exercises before you can go home. So it was just doing all of that at home and then doing all the exercises that they taught us. Yeah, without doing all of that, I feel like without taking the physio, doing everything they had taught me, the recovery would have been a lot longer. And my breast care nurse, she also taught me how to look after myself when I hop out of the shower, just some tricks to actually put pillows on my bed, lay a towel down. It's easier to get changed like that, which made recovery a lot easier because I could shower myself and not have to ask family and friends to help me. The next step in my recovery is a scar revision surgery, and we'll be just removing some of the excess skin around the scar. I feel amazing. I absolutely love my body. So it's been 9 months since my surgery, and 4 months after my surgery we got married and I got to wear my dream dress. When I first tried my dress on, I was flat-chested. on one side, and then so when I went for my final fitting, looking down and feeling feminine. Best piece of advice that I would have would be to talk to other women, to join some of the groups online. There's some amazing groups in Australia and worldwide for women that have actually been through breast cancer. Everyone's results are different, and I just feel that if you can get a vast range of information before you go into something, it just prepares you for what you're going into. So looking back at my procedure, it was a lot easier than I anticipated it being. Having the knowledge going in, so knowing what to expect, what compression garments I had to get, everything like that in preparation made it a lot easier. And I just feel the recovery, being strict in the first few weeks of recovery, made recovery a lot easier. So I got a lot of my information from online groups, just reading people's experiences. My breast cancer nurse, she also put me in touch with a couple of women who'd been through the surgery, and that really helped, hearing their first-hand knowledge, knowing what compression garments to get, what things to take to the hospital to make life easier. Being diagnosed with breast cancer with young children was incredibly hard. I think it was one of the hardest parts of recovery and treatment. So I had to have a lot of help so I could have the surgeries. Without the help of friends and families, it would not be possible. So that was my biggest thing that I needed around me, was support to help take care of my children, since I couldn't lift them or carry them for potentially 6 weeks.